hunt for patient SU, who may have been first COVID case infected by Wuhan lab leak weeks before first outbreak. The hunt is on for Chinese woman known as patient SU, who may have been the first COVID case infected by a potential lab leak of the virus in Wuhan. It is claimed that the 61-year-old contracted by a mystery condition in November around 1 month before China reported the outbreak to the World Health Organization. China is facing mounting pressure to come clean as circumstantial evidence continues to emerge that ties COVID to the Wuhan Institute of Virology. British spies have now admitted the theory is feasible. US President Joe Biden has ordered a redoubled investigation, and a new paper claims to have evidence the virus was engineered. And amongst all this is a mystery woman known as patient SU, reports the Mail on Sunday. It is claimed a mistake by leading Chinese official disclosed the details of her case, as she may have been one of the first infected with COVID. The screen grab included a Chinese medical journal source. Patient SU lived around 3 miles from WIV on Zhongnan Street. She fell ill with COVID-like symptoms in November and was taken to the nearby Rongjung Hospital in Wuhan. Professor Yu Suhana, professor of biostatistics at Wuhan University, told Chinese journal Health Times that he had 47,000 cases on his national database of confirmed and suspected cases by late February 2020. Amongst cases, he reported 2 women who were treated in November. Most personal details were blurred out in screenshot of the medical records, but one of the November cases is the sick woman known as patient SU. Her close proximity to both WIV and another less high-security lab run by Chinese Center for Disease Control around 1 mile away raises further questions about the possibility of lab leak. We were able to pinpoint the exact name, age and address of a very suspected case nearly 1 month before the official first case. Gil Stemnov. His report also included a patient who got sick and died in September, but no further details were released and her case could not be categorically tied to COVID. China furiously denies everything last week, attacking US President Joe Biden as it accused him on playing politics and reheating its own substantiated claims COVID may originally come from the US. It officially acknowledges its first case of the killer disease was on December 8, weeks after patient SU is reported to have taken ill, and the virus was first reported to WHO on December 31. The revelations were uncovered by Gilly Stemnov, a data scientist who works with online sleuth team Drastic, who are independent investigating the origins of COVID. He said, "We were able to pinpoint the exact name, age and address of a very suspected case nearly 1 month before the official first case. That address is right next to the subway line number 2 and also not far from People's Liberation Army Hospital that treated some of the other earliest cases. The subway system carries 1 million people a day, connects to the wet market and international airport and the Wuhan Institute of Virology. China's rail network, as people went home for the Chinese New Year holiday, is believed to have played a key role in the virus' early spread." Drastic previously told the Sun Online about missing database from WIV which could be a smoking gun on the virus origin. WIV is known to have been carrying out gain-of-function research experiments designed to soup up viruses to make them more infectious alongside the US-funded EcoHealth Alliance. Scrutiny is ratcheting up on China, with questions over lab safety at the facility, as researchers previously admitted being bitten and sprayed with bat blood. Despite being condemned as a conspiracy theory for the last year, the possibility that the pandemic was caused by a lab leak has become increasingly mainstream in recent weeks. And meanwhile, there is renewed scrutiny on Mozang mine, where a mystery virus killed 3 miners in 2012 and from where COVID's closest living relative was recovered at a 96% match. Cover up. It emerged this week that Boris Johnson was briefed on a possible lab leak origin for COVID as early as April 2020. The extraordinary revelations show how seriously the West is taking the possibility, despite the narrative being firmly dismissed in the early days of the pandemic by scientists and politicians. China has long been accused of covering up, distorting its role in the early days of the pandemic with claims the Communist Party manipulated case and death figures while withholding information from WHO. But as more and more questions emerge, even WHO have ordered a fresh probe after its first effort was derided and accused of being a whitewash. Biden's predecessor Donald Trump repeatedly suggested in the final months of his term that the virus came from WIV and insisted the US had a concrete evidence. And his former medical advisor Dr. Anthony Fauci made his own admission that he is now no longer convinced that COVID originated naturally and called for a full investigation. British MPs are continuing to demand a fresh investigation after first calling for one when speaking to the Sun online back in January. Meanwhile, a senior Whitehall source told Telegraph that British officials are working with new US probe into the killer outbreak. It emerged last week Wuhan lab staff became sick and needed hospital care weeks before China admitted it was facing an outbreak. Citing a previous undisclosed US intelligence report, the Wall Street Journal said the dossier revealed fresh details and claimed the lab workers fell ill in November. Meanwhile, it emerged that China had probed weaponizing coronavirus some 5 years before the outbreak. There is currently no evidence to suggest the virus was intentionally released by China. Thank you.